Vision problems, hearing problems. There was multiple.
I just felt really, really worn out. Really bad headaches.
Seizures, strokes, just plethora of things that happen that I can't explain other than the virus. They can't explain.
We heard from these three men last night about their road to recovery after contracting COVID-19. Months, even years after infection, they're still dealing with the effects of the virus today. These are what doctors call COVID long haulers. I caught up with a local clinic working to get these type of COVID patients back on their feet. Tonya Nichols has seen a lot of COVID patients throughout the pandemic. She's a family nurse practitioner who oversees Cone Health's post-COVID care clinic in Greensboro.
We get patients who have neurological symptoms such as headaches, tremors, memory loss, brain fog, and then a lot of our patients have extreme fatigue and deconditioning after COVID.
The clinic is the first of its kind in the area. Since opening in March of last year, hundreds of COVID long haulers have sought help there.
I couldn't get warm.
Including 50-year-old Tim Bound, a Summerfield native who recently underwent brain surgery to alleviate some of the long-term symptoms brought on by COVID-19.
Then I had suicidal thoughts.
He shared his symptoms with us, one of the many long hauler stories we've heard.
Blackout spells, multiple times, So we got him in with a referral to neurology, and they examined him and did an MRA, and that's where they found the aneurysm in his brain. And we also got him in with cardiology because he did have some heart issues as well.
Nichols says patients with severe COVID symptoms have received help from the clinic anywhere between 3 to 6 months.
When it comes to long haulers, why do some people have these symptoms for so many months and then others might just have them for a couple of days? Have you all been able to figure that out?
Yeah, there's, I haven't gotten a good answer on that, but a lot of it has to do with patients' comorbidities, whether they're sick or how physically fit they are going into getting COVID and versus their outcome.
As the pandemic rages on, Nichols says the clinic will be there to help in any way it can. Appointments at the Post-COVID Care Center are available through physician referral. If you miss any of the stories in my Long Hauler series, you'll be able to see them all in a 3-chapter story on WFMYnews2.com.
What was your biggest takeaway after doing this? Like what surprised you, I guess, the most?
Just how this virus affects people in so many different ways. You have some people who might lose their sense of taste or their smell for a couple of days. Then you have a man who literally had to undergo brain surgery after being infected with COVID-19, people getting depressed, people having to get toes amputated, seizures, all those different things. It's just so interesting how this virus works. And even though restrictions are loosening, a lot of mask mandates are lifted, this virus is still very much alive and well. And I think that was my biggest takeaway from this story.
I think even though the vaccine, obviously it works, right? I mean, a lot of people have minor symptoms, but some of those long things can still stick around even if you only had minor symptoms with it. I know because I had it early on, and I think my hair is thinner than it used to be.
It could be.
That's one of the
hair loss is one of the symptoms.
Yeah. First off, you did a fantastic job on all of this.
Thank you so much.
I think it was so important that these stories were told. I've seen it happen. My mom still does not have her smell back after having COVID. She still can't smell. She had COVID in 2020. And it's 2022, and there's still some things her doctor has her doing, like smelling exercises to try to help bring it back, but she fully doesn't have smell back. It's truly wild.
Bizarre how this thing all works, but thankfully a lot of these men that I interviewed yesterday, they're getting their lives back on track. And if you're someone that is a long hauler, the COVID Care Center really is helpful. They help get people in contact with primary care physicians if they don't already have one, and they really see you from start to finish once you get out of the hospital.
Yeah, we'll still be learning about this for years, I think, to come for sure.